Stop it.
Good afternoon. I would say good morning. Good afternoon, everybody. Welcome back to the Education Livestream series here presented by the Asian Community Development Council. My name is Patrania Poonswan. You haven't joined us before. We try to touch on topics affecting the AAPI community every week. And this week, as you see there, we're talking about mental health and specifically connected to the AAPI community. So today, I'm so excited to have a very special guest on with me. Her name is Susan Lewis. She's a board-certified nurse practitioner who's practicing right here in the Las Vegas Valley. Susan, thank you so much for taking the time to join us today.
Thank you.
It's so great to have Susan because I've been talking to Susan, how this past year has been with the COVID-19 pandemic and with, the struggles and challenges people are going on in this community. ACDC has been helping so many people in the community, especially when it comes to, people who've lost their jobs, their income, all kinds of problems on the outside that are, in turn affecting people on the inside as well. And that's why we're talking about mental health. And, I'm touching on this because we've seen some recent reports, one of them showing that API community 3 times less likely to seek mental health services than the white population here in this country. And also in 2016, a study by the Centers for Disease Control showed that half of all suicides came out of the AAPI community. So Susan, just hearing these statistics, I don't think you're surprised by this, but I think a lot of people may have not known how big this issue is for the Asian American community in this country.
And that largely has to do with the fact that Asian Americans have a good stereotype, and we don't see them as struggling with mental health or with anything at that, because there's not much vocalization on when they're deficient in anything or they have needs. And then on top of that, there's the stigma of it. So they battle a lot of things, and it ends up preventing them from seeking services. Those are all contributions to the problem.
And I think that is so dangerous, right? Because I think, when you're dealing with problems like this, when it leads to things like suicides, that's just kind of the extreme already. You wanted to be able to catch these things early, especially people dealing with mental health issues. So I know you're a board certified nurse practitioner working. So tell me a little bit about what you do, first of all, and how you deal in the group of people you work with here in the Valley.
So I am specializing in mental health services. I do medication management. There are also therapists in the Valley. So that's when you want more of talk therapy. And then therapies can be called counselors, social workers. They have a bunch of different titles. Essentially, they do the same thing at the end of the day. They'll listen to you. A lot of people don't know they have different modalities, though. So some of them specialize in this or like to do this type of CBT work or whatever. So therapists are also diverse. Typically, people like to go to see a therapist first, and then they go to someone like me who does medication management. And sometimes it's the therapist who does the referral or primary care. So once they come to me, I do medication management, and I've been working mostly with the Medicaid population for the last 4.5 years, and self-pay. Those have been my targets.
Got it. And you work with all different age groups, right? Starting from like 12 to 13 up until, just older age, right?
Yeah, 12 and up.
12 and up. So tell me a little bit about that, because when it comes to mental health, this affects people just a variety of scope and all ages. And talk to me about what you're seeing out there. What are the triggers right now that people are dealing? Obviously, this pandemic is not helping the situation.
As I mentioned earlier this week, it's, I think for me, a few of them would be that us versus them mentality or rage we have going on right now, whether it's race or political status or whatever. We have so much going on. That us versus them, though, our presidents created this China is such a bad, bad place. They're bad people that do bad business, right? And most people can't tell the difference between the different Asians. So a lot of people call me Chinese. You know, the minute you have a monolid, oh God, you're Chinese. You're not Korean. You're not Japanese. You're Chinese. So you're getting bucketed into that group. And so you kind of the Asian American community a lot will kind of like try and stay low key because they're already kind of being targeted in a very indirect way. The other thing would be, of course, like the whole pandemic. So the pandemic's always a big thing. But in my line of work, it ends up being affecting them because they now have online school, or now their kids are home all the time. Or maybe the job that they had, they're not getting the same hours, or they're on unemployment and having financial problems. So COVID necessarily isn't the big problem. The big problem is those other things on a day-to-day basis, causing a lot of stress. And if somebody was already predisposed of being depressed or anxious, it's just exacerbating it a lot. And then they don't feel like they have anywhere to go, or, any person to turn to, or maybe they don't have the coverage or the stigma. So they have a lot of barriers, but those are some big triggers that definitely could be affecting the community.
And one of the things that, when we're talking about the Asian American community not seeking help, we're 3 times as less likely, according to the study here. And you said a big thing of it, we've talked about this before, is, the culture, the stigma. It's like we don't really see this as something that we go and get help for, right? Something that you deal with personally, or something you don't talk about. Have you been seeing that through patients who may be coming from Asian American backgrounds?
I have very few, I'll be honest, patients that are Asian American. I do recall one time I got an older Japanese man, but he spoke Japanese and nobody spoke Japanese. So the minute you need a translator, a lot of offices are like, we just don't have that service. And it takes the appointment 3 times longer to get through, 4 times longer sometimes. So if you have a language barrier right there, you don't want to seek services. Stigma in the US for mental health is affecting everybody, because if there was a shooter, they had mental illness. Like, it's just, we don't want to stigmatize it, but then we stigmatize it. So like there's this, so everyone's dealing with that stigma. But then you also have the cultural in-house, living at home, that stigma, or not that stigma, but that pressure that you need to just get over it. That's not real. So or pill shaming. There's a lot of pill shaming, I've noticed. So you can take a pill for a headache, but you can't take a pill because maybe your serotonin levels are too low. So we have just those things like in our households that when the people around us don't believe in mental health, which is a lot of Asian communities, then you just don't get the support, because you have to go through, say, for instance, a healthcare plan, or you have to go through your parents in order to get the services. So it's just, there's just so much going on. But those are some good good ones.
I think this is kind of one of the reasons we wanted to bring this this conversation out and have you kind of help us go through this, because sometimes people don't hear about it. They don't think it's a problem. They don't think it's out there. They feel like they're the only one, the only one dealing with it. And there's so many people out there, right? Just going through maybe similar situations, but they just don't know that there's help out there, and there's no shame in asking for help.
Right. What I tell my patients, or when I have a lot of patient referrals, is what I tell them is there's a lot of things people can do on their own first before they seek services. Like, or if they have no access to services, whether it's transportation, finances, parents don't believe in it, whatever. There's things that you can do on your own to help you feel better. There's coping mechanisms and stuff like that. So I encourage, even if you don't have access to start with those that you can do at
So
home.
what are some of the coping, like what are some of the things that you recommend? People are feeling that, they're going through these issues and they have nowhere to turn in the moment. What are some of the advice that you can give people in general?
So common ones would be, you need to go outside. You cannot be inside all day. You need to get away from electricity. You need to take a break. Make sure you're getting good sleep. So if you're someone who's going to sleep at 4 a.m. and waking up at 11 and your sleep cycle's all off, it affects your mood, and or you have broken sleep, or you take naps during the day and then you get very little sleep at night. So regulating your sleep cycle, taking a break from electronics, going outside and getting some sun. And there's always controversial and a big topic about that. But we're humans, and so we need to go outside. Eating better. So a lot of foods could be draining, serotonin draining. And so I encourage people to start eating cleaner. For a lot of people, though, that's a variable outside of their control. They don't buy the food, they don't cook the food. So, but if you do have that option, eat less processed foods, you'll end up sleeping better. Substance abuse is another thing that you just have to recognize, that you're self-medicating and that you have to start cutting back. And then the other thing I would suggest right now is just make sure you're getting enough of all of your vitamins, especially with Corona right now and us being inside all the time. And the Valley was already vitamin D deficient before the pandemic started. So let's get our vitamin D, our calcium. We need to get just all of them up. And then it's amazing how much that vitamins impact your mood as well. And a deficiency of them can cause a lot of problems. Those are things that yeah.
And you brought up, one of the things you suggested is just getting away from that electronics, right? The news consumption, that cycle of news that we get 24/7 now, whether it be on our phone, on TV. And so just talk to us about the impact of that on your mental health, especially for young people, because we're seeing more and more young people who are affected by this and, leading up to very, just horrible, consequences. And you said you have your own daughter, 18-year-old, and she's been seeing the consequences of that, right?
Yeah. So there's twofold. There's I call it the immature online culture. And then we have just mass media, which is kind of part of that. So anxious people tend to seek out anxious causing things. So we have an anxious person watching way too much news on COVID. And now they're like having panic attacks and, oh my gosh, you can't ever go outside. And I tell people, I'm like, look, it's not good for you. You can only do X, Y, and Z for the pandemic. And then the rest is out of your control. No need to watch 10 hours of news. And it really helps them. I tell them, you get 20 minutes in the morning of news. That's it. And then see how your day goes. And it always helps them. The other thing is on social media, you could seek out anything you want. You could go down, I'm depressed and I want to see other people depressed and how they're managing it in their dysfunctional ways. And then you can go down and say, I'm depressed. How can I get better? So we need to just learn how to go in the more positive healing direction, because negativity is so easy to find, especially right now. We have to make an active effort to seek out positive things and then avoid depressing or anxiety provoking things like watching the news.
Sometimes easier said than done, but if you can make this kind of intentional effort, right, to maybe kind of limit the time that you spend watching the news or swiping through your phones, and get outside a little bit longer than you would. I think that would help.
And watching this is something that's absolutely positive.
And, and I wanted to talk a little bit about, you mentioned this earlier too, about, access to care, and not everybody have that equal access to healthcare, which includes mental health. But you said especially for the Asian American community or minority community, the importance of having that, cultural sensitive. So talk to us a little bit about what you think would be good to have more of to address the needs of the Asian American community.
Oh, don't ask me what we should have more of. I can go on. But regarding this, yes, I did mention that once someone takes that long journey and overcomes all those barriers we talked about earlier, and they finally get in to see a therapist, or they finally get in to see psychiatry, then they have someone who doesn't listen to them, does not understand their problems at all. Like, how is that a problem? You got a B+ and you're devastated, and well, when in your household you're supposed to be perfect academically, right? That's all part of being culturally competent. And part of that is also knowing like someone's diet and, what foods they're going to be prone to eating. So the culturally competent care is really hard to find. And then when you find someone that provides it, maybe they don't take the insurances that you have, or that you have an option of getting. So then what can you do? You finally found someone, or you were referred to someone that was really amazing. And now what do you do? Well, the truth is that self-pay is a big thing now. When people realize you have to meet your deductible on your health insurance plan first before insurance will start to help you. So basically you have a monthly premium so that you have to pay, say, $4,000 out of pocket first before insurance will start helping you, right? Well, guess what? If you go to a lot of practices now, you can just ask them for the cash rate, and then be a self-pay patient and put it on your credit card or whatever. That's a better purchase than, all the other things you're buying online. And then maybe get, some points for it and address your mental health needs. So,
so there are options out there that maybe people aren't aware that they have in order to address mental health, right?
Yes, absolutely. It is 100%. I don't know any of my other psychiatry colleagues that do not take cash. Yeah. So now this is the catch. People don't know this. As a provider, I'm credentialed, say, with a health insurance plan. We'll say health insurance plan B. Okay. And if I accept their patients, I agree to accept a specific rate. Okay. Now, they're all contracted rates, even between lab companies and health insurance B. So if you come to me and I have a cash rate of, say, like $50, but the contracted rate is $80. When you go to pay off your deductible and you're paying down your deductible, you'll be sent a bill based on the provider and plans negotiated rates. So you can negotiate more affordable self-pay rates. If you don't think you're going to meet your deductible, it's August and you're seeking services and you have a high deductible, just go and ask what their cash pay rates are. If you end up liking somebody, when open enrollment or whatever comes around again, try and find a plan that they take and that you can afford. So there are options, especially at the end of the year, right?
Yeah.
When you have to meet that deductible and you haven't paid into it all year, but you're like, okay, now's a great time. Self-pay, ask what the self-pay rates are everywhere.
It's so important because, we're talking about mental health, but obviously, getting to that point of getting help, so many barriers. As you say, so many things that people need to think about to even get there. But I think the core thing that we wanted to address today is to realize that if this is an issue, to address it, right? To try to get help. Because, if people don't, talk to me about that consequence of any age, really, if you just kind of let these kind of issues fester. What eventually happens, obviously, the worst case scenario is people take their own lives. And we've seen that happen more often than we'd like to see.
Yeah, this is true. And on another note, there's also apps and stuff. So if you need therapy, there's a bunch of apps. I have therapist friends that use apps that are providing care through the apps now.
So people can just pick up their smartphone, right? And they can get help. And it's as easy as that. But, people don't realize or don't think about these things, which I think it's great that you're bringing up, because these are the different options. And even with just an app, do you feel like that's maybe just a starting point and good enough to even get people to kind of even think about what they're going through?
You know what? Telemedicine right now is the standard. An app is just telemedicine. So don't feel like you're getting less of a service when most providers right now are all providing telemedicine. And when I did back before the whole COVID thing, and I did telemedicine for Reno, in the beginning, I didn't know if it was going to be effective because I was really good in person because I can read nonverbal body language and sense people and all this other stuff. I didn't know if I was going to do it for my telemedicine patients. So I required myself to fly up once a month just to put eyes on their bodies. And what I realized is those patients got better too. So yes, absolutely.
And I feel sometimes maybe people who are maybe just kind of have that anxiety of even seeing someone, maybe just doing it via an app or telemedicine, maybe they're more prone to open up. I mean, do you see maybe patients who are more, maybe even more comfortable doing something like that?
True. And they don't have to sit in a lobby and stare at other patients and be like, oh, I wonder, and feel like they're being judged. You can go sit in your car and have your appointment and nobody would ever know. It's between you and the therapist, right? Finding med management services on via app is a lot harder. I'll just be honest with that. And they will not prescribe controlled like Adderall, Klonopin, those kind of meds. They will not, absolutely. So just FYI on that. But when it comes to therapy, I think it's a great option.
Yeah, no, that's really interesting. And if you're watching us on Facebook right now, again, we're talking with Susan Lewis. She is a board certified nurse practitioner specializing in mental health. And we're bringing this issue to light because it's something that is taboo, right, by a lot of communities, but especially with the Asian American communities. You know, people have been talking about this, new research coming out that we're less likely to seek help. Maybe a lot of families, a lot of people don't see this as being a real problem. I know I grew up, you know, just in my community, I used to hear people thinking, oh no, you know, you're just thinking too much, you know, or you're just sad, just snap out of it. And they don't see that as a real issue. And I'm sure you've seen this with not even just Asian Americans, but maybe people coming from backgrounds where they just like, they're supposed to brush it off. It's not a real medical problem. So how do you kind of address that and bring that to light and get people to get help when they need it?
So my daughter brought up a good point. She said, Mom, I didn't even know I had anxiety. Like, you kept telling me I have anxiety, but I don't know what anxiety is. And people don't know if they're actually depressed. Like, is this enough to like get help? My suggestion for those situations where people lack really good self-awareness or lack of knowledge is to start the process anyways. Like, just something's not right. Go to your primary care doctor and start the process. Maybe you just have, you know, you can't get out of bed. Maybe you're anemic. Maybe your thyroid levels are off. You need a medical workup as well. So
even if not physically, you're feeling something. If you're feeling like you're not well, like inside, like mentally, that's something that you need to take seriously, right? And go to a doctor. You feel like you need that help. I think that's kind of what you're trying to. It's like, just, you know, get help, even if it's just your primary care doctor to start off.
And I prefer you to go see primary care first, because if it is an anemia problem, nothing I do with medications will help. Nothing. So I prefer you to go through your primary care doctor, get all your blood work done, make sure don't have a B12 deficiency or something else that could be causing it, and then be referred to mental health, or, you know, because now we've ruled out X, Y, and Z. So yeah.
And I think another topic I wanted to address, and especially because you're a mom of a teenager, you know, and I think a lot of parents who may be watching right now, you know, they're, you know, kids, like you said, online learning, not having that, you know, usual constant contact with like friends and family. What are you seeing right now, especially with teenagers, and what are they kind of coping with that maybe pre-pandemic you haven't seen as much of, or how is it affecting them when it comes to mental health?
Oh, my teens. Oh, they are appalled by their quality of online education. Most of them don't even get out of bed to log in online. You would think that they have like a lot less like social interactions, but social media has just super increased. And I want to say with teens a lot, it's TikTok.
Mm.
Thanks to my daughter's input,
Yeah.
she let me know these things. I'm
Right.
like, what's TikTok? So, what do you call it? As far as teens, they
And
are
that's not
also
necessarily healthy, right? I mean, you know, when it takes something kind of to the extreme and you're seeing social media can really kind of exacerbate that if they're already dealing with, you know, mental health issues.
right. My daughter mentioned that just because they're not going to school anymore, kids are still being bullied. It's online bullying, and it continues.
Right.
People with low self-esteem and maybe don't feel part of a group right now, the number of hate groups popping up to be, you know, recruited into is really high. I've also noticed that they're eating really poorly because they're always home. They're junk food eating a lot. Their sleep-wake cycle is really off. And then there's always like that parent or parents and teen dynamic. So they're all staying away from each other a lot, you know, so they don't get on each other's nerves. And for anyone who lives with like a parent with like substance abuse or already had anger issues and now they're home all the time, they feel really trapped. So and then their parents are watching too much news, so they can't go outside. So teens are definitely still going through a lot, even though they're not going to school and dealing with those usual school-related problems. So,
I mean, what's your biggest advice? Obviously, you know, always say, you know, open, have that line of communication, but sometimes that's easier said than done, right? So as a mom and, you know, someone in your field, what advice can you give parents going through these things right now?
I think as far as parents with kids in the house, I would say pay attention and try to participate in their online education because they're having a lot of frustrations communicating with their teachers. Oh my God, the list goes on and on.
Right.
And the quality of the education, the parents can now see, like they can be in class with their kids or whatever. Because in the Asian American community, education is such a trigger of problems in the home. Like, mom, I can't, you know, I didn't get a good grade on this paper, but look at what she said and look at what I submitted. And then you can be part of the, you know, classroom with me. And then they can start to see like the frustrations that are happening. The other thing I always say with parents is stop acting like you can tell kids to get off of social media because all they're going to do is just hide it from you. Be more open and learn about these. I had to learn about TikTok last week. Like I felt really dumb, but I see why it's drawing them in so much. I'm understanding it. And then my role as a parent would be, I need you not to use it like this. I want you to use social media like this. You know, have the ABCs of social media down so you can have that conversation with your kid. Because if you can't communicate about social media, you're going to lose your kids. It's their whole world almost. Yeah. So education and that social media component, be a part of it. Don't distance yourself and then get angry when things don't go right. Be a part of it.
Yeah. You know, I'm sure that this kind, you know, these advice you can actually just kind of to any parent, you know, any community, definitely, you know, but, you know, when we're talking about Asian Americans, you know, the issues when it comes to like racism, you know, when it comes to bullying and, you know, things that are out there, there's just so many, you know, topics that we can go into. But I think this is a good start in terms of creating this conversation and maybe getting people to get help when they need it. Any silver lining, anything that you can think of this year, just with everything that's happening? I know people are kind of looking for that light at the end of the tunnel. I mean, what do you tell your patients, you know, just to kind of, as they're trying to get through this kind of the darkest days, which some people are calling it?
I tell them this is an amazing time to get your health together, to figure out, you know, like your habits, or if you have way too much stuff at home, like you just learning to have more of a minimalist life because you're living in your environment all the time. Like we don't need all that stuff. Right. There are some things that we could work on, and to tell people to go exercise every day. I mean, that is just like unrealistic. I tell myself every day to go exercise and I still can't do it. But the pandemic allows us to look more into our health, our mental health. We have to be more consciously aware of how the online culture is affecting us.
Right.
Like before, maybe it was like a quick thing here, quick thing there, but now it's like you're being consumed by it. So now you're just super depressed or whatever it is. I love the whole being more minimalistic during these times. And then when the pandemic started, realizing what you need and what you don't need, your wants and needs, that's pretty awesome. And then supporting, I really encourage people to support the small businesses in the community, because our big businesses are exponentially growing and our small businesses are falling apart. So this is a time where our community could support our small business more actively, instead of being more out of convenience. Let's, if you have a choice between, I don't know, this restaurant or this restaurant, and this one is family owned, go with that one instead, because we know that they're struggling right now. And this is a time where we can do things like that. Yeah.
And, I've always heard that, the things that keep you happy and living longer, everything, it comes down to relationships, right? It comes down to that healthy relationships you have both with yourself and, of course, with people around you. So I think that is a good start. And as you say, supporting the community around you. And, I want to rather call it physical distancing, but not social, right? Because we can still stay social and connected while being physically distance and safe. So, and hence we're doing this via Zoom, right? We can still talk and have a conversation and help the community, and hopefully get some good advice out there. So thank you so much, Susan, for sharing your time with us this week and giving us some advice. And, if people want to reach out and get out to you, and Susan Lewis is the board certified nurse practitioner, and she practices here in the Las Vegas Valley. So thank you again for all your help and for talking to us. And for everybody watching, thank you so much for tuning in, and we will see you on the next episode of Education.